Welcome you to the October meeting of the Board of Early Education and Care. Since we last met, a lot has happened. The passage of a historic child and family tax credit, the rolling out of new childcare financial assistance policy, and these are not inconsequential things and tied to our collective commitment to improving access, affordability, and quality. I want to thank the collective effort of the department, the legislature, this board, the administration, for their continued commitment to our work. There's a lot of change happening in the field and within the system, and I want to recognize all of those in the field that are experiencing that and continue to challenge you to add your voice to the conversation over the next couple of months and years as we all strive to get to that collective goal of ensuring that every child across the Commonwealth has what they need to be successful from day one. And so today we'll continue that work as we look at an overview of the childcare licensing revision process and our EEOST proposed regulation changes. But most importantly, I wanted to end my comments with a shout out to all the teachers out there. Last week was World Teachers Day, and I want to thank teachers across the Commonwealth for their steadfast commitment to our kids and to our collective work to improve the systems of support that are needed for kids to be successful. We could not do this work without all of you. And on behalf of the children and families that you serve, we say thank you. And with that, I will turn it to the secretary.
Thank you kindly. I think I should start by saying that brevity is a virtue. Buckle in, though, because that's not going to be the virtue.
A lot happening.
Lot happening. Lots of good things and lots of areas for stretch, and I think I'll give voice to those. First, I'll start with thanks to my colleagues on this board, to Commissioner Kershaw and her team for the successful rollout of the child care financial assistance programs. Clearly, one of the top priorities of this administration is making child care affordable and accessible. These new regulations and policy changes, in our view, help break down barriers for our economically disadvantaged families and for early education programs, making services more user-friendly and equitable. With centering families and simplifying processes for providers, we're creating the system that our youngest learners and families deserve, and I'm just really, really proud to be a part of that. So I'll start with those thanks. Looking forward to continuing the regulation review process, including today's conversation, and I'm eager to have the conversation and learn more about the changes we can make to better serve children, families, and our child care providers. I'm also looking forward to a future discussion about the regulation review regarding the Commonwealth's residential schools. EEC is a partner with other state agencies in the state's oversight of these schools, and so we're coupling that review with coordinated engagement with other education agencies and placement agencies to identify the action we can take to improve care for those students and their families. EEC has already made improvements to the background check process for residential programs, did so over the summer, which modernized and expanded the background check process to promote child and student safety. So look forward to that conversation in the weeks to come. School is well underway. And one of the features, wonderful features of my role is the opportunity to get out and visit schools across the Commonwealth. I was thrilled to join the Chelsea Public Schools last month for a visit to their intergenerational literacy project, where I was able to spend a few moments with the young children in that program while their family members, their parents, were in adult literacy classes. To that end, I'm excited about the ongoing partnership between EEC and the Department of Elementary and Secondary Education as we hope to bridge the gap in early education between early education, pre-K, and our youngest elementary grades. Much more to come on that front, but this cross-agency initiative is critical, and I'm proud to be part of that gap, that partnership that we're bridging. Speaking of partnership, I want to shout out the work that's being done by EEC, the advocacy groups, and community-based agencies to better understand and meet the needs of young children whose families are currently receiving emergency assistance and shelter from the state. Thank you for meeting that moment and working together to address those needs for those young people and their families. And with that, I will leave you with this. Does anybody know what next week is? Thank you. The marketing is working. Okay, so I'm pleased to announce that this year's STEM Week will be held next week, the 16th to the 20th. The theme for this year's STEM Week is See Yourself in STEM. And this year, we are highlighting the importance of STEM education in our fight against the global climate crisis. We're hoping to remind students that their STEM future is our STEM future. We all depend on future STEM leaders and innovators to deliver the progress and sustainable solutions that'll make Massachusetts a world leader in combating the climate crisis. I ask next week that you join me in celebrating STEM Week across the Commonwealth. For our youngest learners, that could look like reading a science book, engaging in do-it-yourself science experiments, and discussing STEM concepts like weather or robots in classrooms and in homes across the state. We hope that students of all ages, families and caregivers, providers, and educators end this week with an increase in awareness in STEM education, and we thank you for your partnership in that work. For more information, folks want to dive a little bit deeper, mass.gov/STEM Week. And that is all.
It's all good stuff. Thank you for your partnership, the administration's partnership. You mentioned the term meet the moment. There's a lot of that happening right now, and do applaud the partnership with the administration and the department and the legislature and the field and everybody for their continued work to meet that moment. With that, I'll turn it over to the commissioner.
Thank you, Mr. Chairman. Thank you, Mr. Secretary. We definitely see early education and care in STEM, so we see ourselves there and are looking forward to a week of events to celebrate and lift up the role early childhood education can play with families and children in exposing them to STEM. Couple of updates from the department. First, as all of you are aware, we lost our chief operating officer, the first one the agency has ever had, to the state of Minnesota, as Greg Norfleet, left and was recruited away to run their Department of Family and Medical Leave. And we were so sorry to see him go, but wished him well on his way. And I'm very, very pleased to announce we have a new chief operating officer who will be starting on October 23rd, and that's Catherine Harville-Haney. She's currently the Chief Financial Officer at the Executive Office of Health and Human Services. She is a proven innovator and leader, brings strong fiscal and policy skills, and we are really excited to have her join the team, and we'll have a chance to introduce her to you. I also want to take a moment to thank and say goodbye to Kelly Meehan, who is our regional director in the Metro region, or Region 6, as sometimes it's commonly known. She left us after 7 years with the agency to take a new opportunity with People Inc., and I just want to thank her for her service and her leadership, particularly during the COVID years. I know how important her partnership was to the providers in the region, to the educators, and to her staff. So we wish her well, and we look forward to welcoming a new regional director for that area. Look for that soon. I thank you, Secretary, for your comments about the Childcare financial assistance implementation. I also want to add my thanks to the team and also to our many family access administrators and programs that are out there. We are very excited by having hit the milestone of the effective date of the implementation on October 1st and the issuance of new policies. This implementation, as we shared with you last month, will be done in phases. So the first phase, where a number of things will be taking effect on October 1st, and then we'll be phasing in additional changes as training and IT requirements and developments take hold. So we are anticipating training starting also on the 23rd of October, and looking forward to sharing that with our field. So a change in this order of magnitude, as the Secretary said, change is a process, not an event. So we hit a very important milestone on October 1st, and we anticipate that this will be a 12 to 18-month implementation. There'll be culture change, there'll be IT changes, and we hope there will also be patience and grace with the agency. As we know, a change of this magnitude can be a little lumpy, bumpy, and we look forward to doing it in partnership with our stakeholders as we have all along. So thanks to the team that's working on it, and thanks to all of our partners who are out there implementing these new changes and working with us to make sure we're doing it in the best possible way for families. Very pleased to let you know that the childcare cost study that we did with the Center for Equity, Center for Early Learning Funding Equity, commonly known as CELFIE, is now posted. So that report has been finalized. It's posted on the EEC Research and Data page in English and Spanish. This is the first one of its kind that we've completed, and that work, as you know, will inform our rate setting for childcare financial assistance rates, a set of reforms we hope to bring to the board as well. It informs our work across the board around the Commonwealth Cares for Children, or the C3 program, as well as many other aspects of the work of the agency. So I want to thank our partners at CELFIE and the team here, led by Amy Checkaway and Jocelyn Bound, for their groundbreaking work. I think it's going to be incredibly impactful for how we think about the cost of early education and care in the Commonwealth and the agency's role in supporting the child care market. So proud of that work and proud to have it up and posted. Related, I am also pleased to let the board know that we have submitted to the Administration for Children and Families on October 6th our proposal for an alternative methodology for setting child care financial assistance rates. As most of you are aware, we have historically set those using a market rate, which is looking exclusively at the prices in the market. And this alternative methodology proposes that we are able to use cost also to inform how we set rates formally with approval. So we've submitted that request to do an alternative methodology. I think we would be the third state so far to do that. There's probably other states following along. So we will update you on the progress of that, but very pleased to have done that. I wanted to apologize for the inconvenience of the last-minute shift in this meeting to Boston. We had intended to be in Lowell, and we hope actually that we'll be back in Lowell next month. And the board meeting we will have a chance to kind of dig a little bit into rates. We are incredibly pleased that there is $65 million in the FY24 budget to provide a rate increase for our child care financial assistance, and we look forward to beginning that discussion about the agency's approach at our November meeting, which, as I said, will hopefully be in Lowell as we intended this meeting to be. That concludes my updates. Thank you very much.
Thank you, Commissioner. At this time, we're going to move to the public comment portion of the meeting. I know we have a few folks here in the room, so I would like to start by just inviting Michelle Hamowitz from Massachusetts Head Start Association to join us up front here. I also want to acknowledge, as Michelle comes up and gets seated, that the board has received additional public comment via email that's been distributed prior to the start of the board meeting. Michelle, welcome. Thanks for being here.
Thank you, Chair Balsito, Secretary Tutwiler, Commissioner Kershaw, members of the board. Thank you for the opportunity to deliver comments today regarding the upcoming licensing regulatory review process. My name is Michelle Hamowitz, and I'm the Executive Director of the Massachusetts Head Start Association. The Massachusetts Head Start Association is a membership organization that represents the 28 Head Start and Early Head Start programs in Massachusetts. Head Start's a federal program that provides early education and comprehensive child and family services, including health, mental health, nutrition, and family leadership and resources to vulnerable children and families. Federal Head Start grants are provided from the federal government directly to each of the nation's 1,600 grant agencies, including 28 here in Massachusetts. Collectively, these 28 programs serve more than 10,000 children in our Commonwealth, and we serve the most vulnerable children here. Head Start serves children from families earning under the federal poverty level, children experiencing homelessness, and other very vulnerable children at no cost to the family. Of the 28 Head Start and Early Head Start agencies in Massachusetts, 23 agencies operate EEC license centers. As the department begins its review of licensing regulations, Head Start's a ready partner at the table. We're grateful for our ongoing partnership with the department, with Commissioner Kershaw, and the Head Start State Collaboration Office and its director, Amy Whitehead-Plow. We're glad to be at the table with our partners in response to various regulatory changes and work closely together to best support vulnerable families and the programs that they serve. We offer this testimony as a launching pad to what we know will be many conversations, focus groups, and revisions ahead. As this board considers the licensing system over the coming months, we ask you to keep Head Start programs and their experience with licensing in mind. As I shared, Head Start programs that operate in group and school-age settings are required to go through licensing in Massachusetts. We believe that participation in licensing is fundamental to health and safety. But in addition to Massachusetts licensing, Head Start programs are heavily monitored by the Federal Office of Head Start. Head Start agencies are awarded 5-year grants, and their lengthy applications are reviewed at the start of their grant and during annual grant continuation applications. During the 5-year grant, programs receive a week-long virtual review, as well as a week-long in-person intensive review, both with a team of objective and trained monitors. Programs are also reviewed on classroom quality using the Classroom Assessment Scoring System, or CLAS. In addition, the Office of Head Start conducts unscheduled reviews as needed during the typical monitoring schedule or in response to events in the program. Head Start programs are well monitored as well regulated. The Head Start Act and Head Start program performance standards, Head Start's governing statute and regulations, closely dictate program facilities, ratios, staff qualifications, privacy procedures, and more. Head Start programs are required to wholly comply with federal regulations and policies and are monitored on their adherence as I described. Under the current licensing regulations, Head Start programs are licensed and monitored in the same manner as non-federally regulated programs. This process often results in duplication, requiring Head Start programs to submit documentation to the department that's already been monitored by the federal government or receive monitoring visits for the same need. We look forward to working closely with the department in the coming months to rebuild a licensing regulatory environment that continues to prioritize child health and safety and that reduces duplication and burden for our federally regulated Head Start and Early Head Start programs. Thank you.
Thank you, Michelle. Next, I'd like to invite up Rosalina Pinto and Darlene Ortiz from Clarendon. Welcome. Good afternoon. Welcome.
Thank you. Good afternoon. Thank you for the opportunity. Dear Chair Valsito, Vice Chair Muller, Secretaries Weller and Walsh, Commissioner Kershaw, and board members. Thank you for this opportunity to come before to you today. My name is Rosalina Pinto, and I have here my colleague Darlene Ortiz from Clarendon Early Education Services, Inc., a family child care assistant providing a full suite of business and professional development support to 181 educators across the state. I would like to take this opportunity to thank Commissioner Kershaw and her team at EEC for this special work on the revision of the financial assistance policies and procedures. This with the intent to remove barriers in assessing child care financial assistance for families. We believe that we will soon see a great deal of success in achieving that desired results. I am here today to recommend that the Department grant a similar authority to now undertake a very long overdue comprehensive review of the child care licensing regulations. In our role, we provide educators with technical assistance daily, on a daily basis, and having more than 25 years of experience, Darlene, we have experience, and we can testify that many educators in our field, sometimes they get confused with the regulations, and there are many areas of regulation that are unclear and often open to different interpretation. Group sizes and definition, kindergarten and school-age children as they pertain to ratios and supervision are examples of very important section of the regulation that could be evaluated to reduce confusion across different program types. There are also sections of the regulations that can delay the child access to child care. One example in the requirement for the educators is to obtain certificate of immunization admission before the child enters to the child care, while having 30 days from enrollment to obtain the physical statement. In your letters, there's a detail of the regulations and more details that all of you can see. Well, I think that's all said. We thank you for this opportunity on behalf of Clarendon and the families that we serve in our field.
And the educators.
And the educators, yeah, for this opportunity. Well, thank you. Thank you.
Thank you for adding your voice and your experience, so thank you.
Thank you.
Last on the list here, I have Teresa Lynn from the United Way of Central Massachusetts. Welcome.
So I'm really here just to say thank you and give you an update. We, the last 3 years, have been the beneficiaries of summer step-up funding, which has been really incredibly important to our region in Worcester. Each year we serve between 350 and 450 kids that, as you know, would have been unserved, focused on helping them with school readiness, but also socialization for student success, which coming out of the pandemic is, as we know, a huge problem for every child. The thank you part is also about three things. One is thank you for covering actual costs. Because I have been involved in many government grants, and sometimes they cover this much and the cost is this much, and it's left to agencies and program partners to kind of figure it out. So thank you for doing that. Thank you also for providing space for technical assistance funding, because we were able in Worcester to use local partners, such as the Ecotarium, to come into programs and do STEM programming locally with kids. So it's push into programs. And we did that with some mental health services. We did it with literacy. We did it with STEM, and it was really, really valuable. And the third thing is, thank you providing money for professional development. As I'm sure this board knows, this is so critical for this workforce, and a lot of grants and funding opportunities like to fund things and not staff development and providing extra resources for staff. So thank you for doing that.
Great.
That's it. Thank you.
Thank you, Teresa.
Thank you.
Is there anyone else here in the room for public testimony? Great. Thank you to those who joined us today to add your voice. We appreciate it. We're going to move on to routine business. We have before us the minutes of the September 13th, 2023 board meeting. Any additions, corrections, or edits? Seeing none, I make a motion to approve the minutes of the September 13th, 2023 board meeting. Can I have a second?
Second.
Second, Carolyn. All those in favor, say aye. Aye. Opposed? Great, the motion has passed, and the minutes have passed. Next order of routine business is regarding a decision from the Human Resource Division that recently came out in July announcing executive branch managers were eligible to receive a salary adjustment. Commissioner Kershaw meets the criteria to receive this approved adjustment. However, a board vote's necessary to allow her to do so because by statute, the board establishes the commissioner's salary. So I'm asking the board to consider a motion to allow the commissioner to participate in this HRD approved salary adjustment in a manner that is commensurate with the similarly situated managers within the Commonwealth. So with that, I'd make a motion to move that the Board of Early Education and Care approves a salary adjustment for Commissioner Kershaw consistent with the salary increases that the Commonwealth's HRD announced on July 26, 2023 for eligible managers in the executive branch. Can I have a second?
Second.
And I'm going to call the roll. Maura Siegel,
Yes.
Nikki Ruiz,
Yes.
Carolyn Kane,
Yes.
Maria Moeller,
Yes.
Jamela Lee,
Yes.
Linda Sager,
Yes.
Cheryl Travers,
Yes.
Stephanie Carrington,
Yes.
Secretary Tutwiler.
Yes.
And the chair votes yes as well. The motion passes. Commissioner, thank you for your continued leadership and service. And with that, I will hand it over to you to get to the meat of our agenda in our conversation today.
Great. Oh, thank you so much. I'm already slacking on my duty here. Okay, I'm going to ask Andrew Rome and our licensing team to come up, please. And Joy Cohen will be joining the team up here, too. So as you've heard, primary agenda item for today's board meeting is to take a look at the childcare licensing regulations. And this is really the heart of the work of the agency. It is, I'll have the assembled part. Folks introduce themselves in a minute. So childcare licensing comprises the most number of staff in the agency and the broadest and biggest scope of the work that we do. As you are well aware, the agency has been in sort of a stem to stern look at all of the work that we do, opportunities for us to create human-centered design and user-focused services, and that includes the child care financial assistance, the residential regulations, many of our programs and IT systems. And so today I'm really pleased to have an opportunity with the help of our licensing team to share with you sort of where we are on child care licensing. So we will give you a little bit of an overview of the current regulations, sort of the scope of what those regulations do, the number of programs and sort of monitoring, the type of monitoring that we do, so the board has a baseline of understanding of our existing licensing. And then we'll share a little bit about the approach we intend to take to this process. So we are really looking forward to this work. It's been more than 10 years since the regulations have been revised. Obviously, a lot has changed, both in the world and in research and in practice, and in the agency's approach to how we want to partner with a solution-focused way with our programs in the field. And so I'm really looking forward to undertaking this process. We believe it will take time, as all change processes do. So we'll share a little bit about the timeline that we hope to undertake. And we are deeply, deeply committed, as we were with childcare financial assistance and as we are in our residential regulations, to engaging with the stakeholders who live with these regulations every day. So we'll share a lot about what that's going to look like as well. So Andrew, I'm going to turn it over to you, have you introduce the team, and I will let you
have control.
Yes.
Okay. So before we get started, good afternoon, and I'd like to introduce, to my left is Lorelei Chandler, licensor from the Worcester region. Maria Martinez, our regional director from the north. To my right is Michelle Ruxton, licensor from the southern region in Taunton, and Joy Cohen, who I think we've all know, but our Director of Policy. And I'm thrilled to have all of these members here. I will pass this microphone over as we progress. So thank you very much for this opportunity. And there we go. So as the commissioner stated, licensing and investigations is approximately 52% of our agency, and all those staff work out of the 5 regional offices. And as you can see, Springfield, Worcester, Lawrence, Quincy, and Taunton. We continue our commitment to the programs and educators and the families to ensure that we have a diverse staff and that they're representative of the communities and the families and the children, our providers, our educators, programs, with making sure that we have a commitment to language. And so we've done a large increase in our capacity for Spanish, Portuguese, and Haitian Creole, as well as other languages, so that we are representative of the community. Currently, these are regulations, and I'm not going to bore you going through them all, but our intent is ultimately to make these more understandable, to make them available so that our programs, our educators can, it takes away the barriers that they currently have, and also to look at, make sure that we don't have barriers for our licensing staff as well. But really doing what I call partnering with accountability, and that's a two-way street. So it's also meaning not only accountability of the providers and the educators, but also EEC's recognition that we have accountability in all of this as well. And with that, I'm going to turn it over to Maria.
Thank you. EEC licensing has different types of programs and licenses. We have the Family Childcare License Care Group. Those are the programs that occur in private residences. They can have a max capacity of up to 10 children that are younger than 14 years old or 16 if they have special needs. Then we also have the small group and school-age childcare programs, and those are programs that happen in commercial space. And again, those are programs that can receive 10 children or less, and they can be 14 years, under 14 years old, or 16 if they have special needs. And then we have our large group and school-age programs that, again, happen in commercial space. And those are your larger groups. Those are your 10 plus, and those are serving children under 14 years of age or children that are up to 16 with special needs. Our licensing team goes out and does very extensive and sometimes simplified visits to these programs, and I'm just going to touch on a few of those licensing types. We have the pre-licensing visit. This is an announced visit that the licensor does to programs that are looking to become licensed, and so they will go out, they will spend some time doing a comprehensive review of the regulations. It is an announced visit, and they go out and provide some assistance. In addition to that pre-licensing visit, once they become licensed, they then go out within the first 90 days for family childcare and within the first 6 months for center-based. These are unannounced. It's required that we do these unannounced. And again, they spend some time there going over the regulations, doing a comprehensive review of the regulations. Then we have a monitoring visit, and that happens annually, usually between the renewal cycles. For FCC, licenses renew every 3 years, and for center-based, they renew every 2 years. This monitoring visit is also unannounced. It's required to be unannounced. And again, during all of these visit types, we do spend a lot of time reviewing the regulations with them, with programs. And then we have the renewal monitoring visit, and that happens ideally 4 months prior to the license expiration date. These, again, are unannounced visits, and we spend a whole lot of time not only going over the regulations, but also, helping them with TA and anything that they need from us in that renewal process. In addition to those 4 visit types, we also have investigation visits, and we respond to complaints or concerns from parents. Sometimes the program themselves will call and report on themselves just because we need to go out and help them. We respond to concerns from the Department of Children and Families when a 51A is filed, and we respond to any concerns from the general public as well. Those visits can be done either by the licensors, and the more high-risk ones are actually delegated to our investigations unit.
Hi, I'm Lorelei. I'm a bilingual family childcare licenser. I've been a licenser for 19 years, and I'm going to explain to you the part of the process about conducting a visit and when people are applying. So for applicants for family childcare, the first step when they get in touch with the office, we inform them that they need to complete 14 training courses through a program that we have online. It's called Strong Start. After that, they also need to complete first aid and CPR in person. And we always remind them that it needs to be approved by the American Heart Association or the Red Cross. Once they feel that they're ready to start the application process, they have to get in touch with EEC and speak to one of our administrator staffs or a licensor so we can enable an account for them in the LEAD portal system. Once that is done, then they'll receive an email, and they can work on their own account to submit an application. They have to answer questions, and they have to go through the background record check process. Once the background record check process is completed and approved, then the licensor will schedule an appointment with the applicant to do a pre-license visit. During the pre-license visit, we go over health and safety concerns. We do a walk through the home. We check the home inside, the hallways, and we go outside. And we make sure that they also have enough materials and space for the children. The appointments, they probably take about a couple of hours during that process because we have to answer questions, be available for them. We always reinforce for them to read the regulations. After the visit, we generate a report through our LEAD portal system. The system will give them 14 days to respond, but if they need more time, we always give them more time to respond. And then once they respond to all the non-compliances, then we issue the license. Once we issue the license is good for 3 years. And during that time, like Maria explained, within the first 6 months or sooner, depending on the licensor's schedule, we'll do an unannounced visit. So the first pre-license visit is announced, and after that, all the other visits are unannounced. And during the unannounced visit, again, we review any health and safety concerns, and we always generate a report, have them respond to any non-compliances. And then after that, every year, we continue to do at least one visit unannounced. Although sometimes we may do more than one visit, like if there's an investigation or if there's a change of address, they're changing location, then we need to view the new home, the new space to make sure that it's safe for children. They're also allowed to upgrade for the license if they want. After a couple of years, they can apply for the license for 8. And then after 3 years, they can apply for the license for 10. We will also conduct unannounced visits for that. And we review all the requirements because they need more materials and more space indoors and outdoors. So that's pretty much a quick summary of the licensing process. Thank you.
So that's family, and now we're going to look at the licensing journey for center-based.
Hello. So I'm here to talk to you about group and school age, which is slightly different than family child care. So as Lorelei was speaking about the differential licensing cycle, ours actually follows a 2-year cycle. So we also would conduct a pre-licensing visit for any potential provider who is looking to open a program. That's when we go out and sort of assess where they're at that point. We may go over policies that they need, handbooks. We might walk them through some of the licensing regulations that they're not aware of, and just really see what their approach is, because every program is slightly different. When that pre-licensing visit has completed, we then will do a provisional 90-day monitoring visit to go out and see how they're doing after a few months, within 1 year of that provisional license being issued. Some programs may need additional support as well during that time, so it may be more than one monitoring visit. It just depends on, again, where each provider is at that point in time. After the 2-year cycle, we will complete that with a renewal. So it's an every other year cycle. 1 year is a monitoring, 1 year is a renewal. That renewal visit is a little bit more in depth, where we're really looking at children's records, staff records. Do they have everything that's required? Making sure that their policies are up to date and aligned with our regulations in case there's any changes. Some other types of visits that we also would conduct, like Lorelei was saying, so sometimes a program might want to start out really small, say with a classroom of 20, and then after a year or so they might say, well, we've hired additional teachers, we want to increase our capacity. How do we do that? Well, we walk them through that process and how they submit a transaction through our lead system, and we talk about what's required for them to get to where they want to be. We also have programs that may change locations. So it may be you're moving from one address to another address, and we can help them through that. We also have programs that are housed, a lot of them in public school buildings. So they might move from classroom A to classroom B. And that's still considered a type of move that we need to go out and make sure that that space is conducive and safe for children to be in. We do a lot of what we call monitoring outside this differential licensing cycle visit, and that's really, again, a chance to provide support for the provider. They may be very new to the field. They may be saying, what's going on with the regulation changes? What's changing with PRCs? What can we do with the C3 funding? So there's a lot of questions that we get asked as licensors that we're also expected to know the answers, and if we don't, we find out and get back to them. And then we also do conduct the investigation visits as well. We work a lot with DCF. If we can, we will try to pair and go out with a representative for the Department of Children and Families at the same time, so the program does not have to go through interviewing that whole process twice. So we do really try to work and collaborate with them as well. And then, again, the higher levels would get escalated to an investigator. So we deal with all types of complaints as well. And that's that. Thank you.
So in addition to the EEC licensing process, programs are required to work with other state and local agencies to complete permits, inspections, and other processes in order to be able to operate their childcare business. We put together a list. It doesn't include all of them, but these are some of the higher pressing ones. We work with the city and the local departments to make sure that they're getting their permits, their zoning permits, their public health departments sometimes will need to weigh in again if they're serving food in their programs and so forth. The building inspections, the fire inspections, the health inspections, I see that we're having to reach out to the municipalities now more than we did pre-COVID because they're backed up. And so while it is the applicant's responsibility to try to get a hold of these documents, sometimes we as licensing are picking up the phone and speaking to our local inspectors to make sure that we are helping programs move their process along. In addition to that, we work with the Department of Public Health, the Department of Agricultural Resources, DESE, Secretary of State Office for Corporation Filings, and the Department of Revenue.
So we're going to talk briefly about the numbers. All I think is all good news, and hopefully you'll agree. So we start with the licensed providers, and unfortunately, we had this little thing called the pandemic, and saw numbers decrease. The good news is that the numbers have increased, and I think you've seen that before, and rising continuously. So we continue to work towards supporting programs and educators so that we can continue to increase that number, and during this reg review, that is one of the main items, is the regulation should support and not deter. So, and then as to license capacity, we have actually increased that beyond the pre-COVID numbers, which is just amazing and wonderful. And I applaud the licensors and the regional directors and the supervisors who have really worked in the regional offices to work with the programs providers and educators to do that.
So this next slide focuses on the center-based providers. You'll see that it has on the left the providers, and then on the right we have capacity. I think you've seen the slide before, is what I've heard, and I've seen in other board meetings. And as you can see, all the numbers are trending in the right direction. Most regions are at or have exceeded with center-based where they were pre-COVID. This doesn't include those programs that are currently in process to be licensed, and we're working really hard in the regions to build capacity. There's a lot of work being done by each region to make sure that we're increasing program capacity and in turn then increasing child capacity and the capacity to be able to serve more families. And then this next one is basically the same thing, except for family childcare. It reflects the numbers in family childcare. Family childcare is a little behind, but we're working hard to get caught back up. Again, we have plenty of applications in process, and I'm sure that these numbers will increase very soon.
And so here's just a slide showing the newly licensed programs over time. Again, the numbers are going where we want them to go. I do want to point out that the 2023 numbers are to date, so we expect those numbers also to go up higher by the end of the year.
Do you want to open for questions just before we
Sure.
jump to any questions from anybody? That's my way of saying I have one. Two things. You mentioned application. I'm just curious before we get into kind of future state here. What's the turnaround time? So if somebody applies to be an FC, a family child care center, like I'm trying to think of that journey of decision making to say I want to open a small business in this field. Like, what does that look like from the start point?
So I honestly don't have that number with me. It's a number, though, that we're looking at. There are many factors that go into that as well. Some of it is up to the cities and towns and how quickly their building departments can get out, their fire marshal can get out to issue those certificates. But we are looking at, hopefully having it soon, is numbers on actually how long does it take from application to licensure, and then also needing to then look at, so why did it take 50 days versus 45, et cetera, and again, trying to then work on solutions for those issues.
Yeah, and it strikes me, I like the slide of just how many different government agencies a lot of these providers are working with to get up and running, which, to me intersects with the workforce connection as well, of just, that doesn't even take into the account of setting up HR systems and payroll taxes and shit. Like, there's like just this body of work that we need to make sure we're decide how we want to support kind of small business owners in just the operational aspect, never mind just the health and safety of children, which should be paramount in all of the things that go with that. But then these layers of mandates and regulations that are just required to run a small business as well. And so that slide it overwhelmed me to think. And so it just shows me probably the role you all play in this work to kind of be that thought partner beyond even just the licensing piece on how to maneuver the systems. And so it just struck me. So, any other questions?
Sort of a comment and a question. So it seems like in addition to sort of doing licensing, that's the main job that you all have, you're also sort of the main technical assistance providers sort of that are out in the field answering questions every day. So that's just good for us to kind of know that you're sort of that front line facing to providers. I have just a very simple question, which is that when you go into family childcare, what do the kids do while you're there? Because you have to talk to the provider, right? And then, but then oftentimes they're the only adult in the room with the kids.
like for myself, because I've been doing this for a long time, I always remind them to continue working with the children, supervising them. And we show up at different times, so it could be like breakfast time, or they could be doing circle time,
Yeah.
or it could be nap time. It's actually nice to see and go different times because you can see what they're really doing with the children. And what's nice with this new lead portal system that we have, it lets us know, and we get reports like, okay, it's time to go visit this person, but it could happen any time of year. But we always encourage not to leave the children alone and to continue doing whatever activity there is. But it is distracting. The children can help it sometimes, and I'm used to it, and they're apologizing to me sometimes, and I'm like, don't apologize. I'm used to children, and I have my own children too. So it's just trying to put them at ease, because sometimes they do get a little nervous too. It's
Yeah,
not
of
easy
course.
caring for different children
Yeah.
of different families, and they're different ages, and then there's a stranger, and some babies are okay with it, some children are not. It varies, but we always try to put them at ease, and so far it's always been successful for me. I haven't had any issue, and we usually try to give them the message ahead of time, because we do have frequent telephone conversations, and I let them know to please have the paperwork ready at any time, because we do show up unannounced. And they know that once they submit the application, we'll be showing up. There's like a 4-month window that we'll be showing up. And they're usually pretty organized, and they'll have like their children's folders all separated, organized, and their trainings. So we do have those conversations ahead of time to make it easier.
Okay, so everything's kind of like ready for you. They don't have
Yes.
to like sit there and have a whole
Right,
conversation
right,
with you.
right.
They can kind of
Right.
stay.
And
Okay,
so
thank
sometimes
you.
they do try to talk too much to me, and I'm like, well, it's okay. And I'm like, well, oh, and I try to bring them back to focus, because
Yeah.
it's a hard balance.
Yeah, definitely.
But thank God till this day we haven't had any like accidents, because I'm there like interrupting them. It is, sometimes it can get a little overwhelming. Like, let's say if they're not ready, I try to tell them it's okay. You can give me the paperwork later. What's nice, we have, emails. You can send it to me by email. I try to always make it easier for them, so everybody's safe.
Great, thank you.
Thank
Thanks for
you.
the information.
I really appreciate your comments, Nikki, and I was going to jump in if you don't mind, just to recognize the work of our licensing team, because it's much more than going out and monitoring. You can hear that,
much more
right?
than just
So much
licensing.
more. And under Andrew's leadership and all of our regional directors, I think we've really been making a concerted effort to be that technical assistance and partner with programs. That our job is not to go out and inspect and file non-compliances. It is to work with them to deliver the kind of quality and health and safety and care. Especially right now, we're working very closely with our programs and with our regional staff to build capacity in the region. So we want to support them as small businesses. We want to support them to deliver the best care they can. And I've been out on many visits with Michelle already and with Maria. Lorelei, I guess, our time is coming. And 201 in the visits I've been to, the programs have recognized and been incredibly grateful for the work of our licensors and partnering with them, particularly during the pandemic. And then sort of in the pandemic recovery, as folks have tried to figure out how to stay in business and do their work, I think they rely very much on the expertise, which is clearly evident from this panel, of our licensors to help support them. And there are the front line of information, whether it's Childcare Financial Assistance or the Commonwealth Cares for Children program. So we are incredibly fortunate to have such talent and depth of expertise among our licensing team. And we provide, and there is a lot of opportunity, I think, for the regulations to be sort of updated. We heard a little bit about where we might change some things in family child care. One of the things I'm really excited about is I think we have an opportunity for our out-of-school time and extended learning programs, particularly those that are operating in schools, to do that in greater collaboration to make sure we're supporting and facilitating access for those programs and partnering with them. So.
I have a quick question.
Yeah.
Or a comment. I mean, obviously, because I'm in the field, I know, but I wonder if they could talk a little bit about, there's a lot of similarities between what licensing offices do, but also the family childcare systems, and like how do you partner with them to, obviously help in quality and additional visits, obviously, because those providers also get additional visits.
Yeah, so he's giving me the microphone, so I'm guessing I get to answer that question. So we do work very closely with systems. they're wonderful. If they go out and their visitors are seeing something that's not aligned and they haven't been able to get the message through, they will call the licensor and they will go out and do a joint visit. We have working together meetings where we spend a lot of time sharing the things that we find out in programs so that systems are learning from each other. Of course, we're not saying where we found what, but we are sharing what we're finding so that we're learning from each other. We're learning from those visits and systems are able to support us. The partnership is there. The partnership is strong. And I really do think that because of the strong partnerships, we're able to do a better job. We know that we've got extra eyes out there because we're only out there maybe once a year, twice a year, maybe 3 times a year, where the system is out there sometimes twice a month. And if they're seeing that a program is trending in the wrong direction, they call us in. We partner, we go in there, and we provide the resources that we need, and we can hopefully get that program back on track as quickly as possible.
I will also add that you also provide technical support for the systems themselves, so they call you.
Yeah, absolutely.
I have one other question. I also just so appreciate understanding. I like the words you used, Andrew, partnership and accountability, and there's a balance between those and just hearing the color behind the partnership is amazing. I'm curious, before we move forward, what, Andrew, are the performance measures today that you look at, sort of the monthly or quarterly things that you're overseeing to make sure what everyone's doing?
So we look at visits and make sure that they're happening and being done. We talk about investigations, and we will have conversations regarding if there's a citation, like does it need to really be a citation, or can it change to technical assistance? Is this really about health and safety of children as well? I'm trying to think what else I look at. Looking at where we are hopefully getting very shortly. We're having a little technical issue, but we're going to get through that to actually have look at the caseloads. There's a lot that goes into that. It's not just numbers, but it's distance, it's language. So a lot goes into that, but we are looking at that. Trying to think, we certainly look at the numbers of newly licensed programs. When we're looking at caseloads, we're going to be looking also at what are the applications that are in process, so that we can work to make sure that our offices can support the new programs as well and support getting them on board. As the chair said, it's great to have new programs, but if it's taking a year to get them up and running, that doesn't really help. So we'll be looking at that time frame as well, but also making sure that we have the support so that we can support the programs to open up as quick as possible and be successful.
And sorry, just to add on to that, do you have I know that we've talked a lot about sort of continuous quality improvement. Is there an overlap between the sort of quality side of things and the licensing? Like, are you sort of looking at a program's
segue.
Progress? Oh, okay, cool.
That's a great segue to sort of where we're heading, right?
Yeah. And the answer to your question is yes, we actually are doing regular meetings with the quality team, the regional directors, and supervisors.
Okay.
And trying to not only figure out how to bring CQI into providers and educators, but also doing something with ourselves so that we're mirroring the same thing. What we're doing, is it the right thing? Is it getting the consequences that we want, or what about the unintended consequences?
Yeah.
Et cetera. So trying to build it on both sides.
Great.
All right, so the regulatory revision. So we have 5 major goals out there. The first is that our regulations support future needs of programs and families. And part of that is looking at technology. We all know that over COVID, you take a negative, make it a positive. We learned technology. We learned how to use it differently to support programs, providers, our agency. So how does that now play into effect as well with the programs, providers, educators as well? We want to get rid of bureaucratic burden. Yes, there needs to be some bureaucracy there, but does that really lead to health and safety, better quality programs? Or is it just simply bureaucracy? And if it is, I can tell you, both the commissioner and I, we don't want bureaucracy just for bureaucracy, and I don't think anybody does. We also want to make sure that there's alignment across our framework, and then we also need to make sure that we have resources available in multiple languages. In doing such, I've asked everyone to look through 6 lenses as we are doing this, and this is in no particular order, but we need to look at through an equity lens, the CQI process, being strength-based. We all know with our own children, it is better to promote positive and not the negative, and I think that we can continue to build on that. Balancing our supports and accountability, being flexible. As Michelle said, no 2 programs are the exact same. No 2 situations are the exact same. So we need to have flexibility and then evidence-based. So as we're going through the regulations, we're going to need to think about what are those metrics to show us, are we meeting what we want to meet? And is there something that's not working that we need to improve? So continuous quality improvement. I'm used to the phrase plan, do, study, act, and so continue to use that and look at it.
Great. So I'm going to talk a little bit about the areas of reform for the childcare licensing reg revisions. As we just talked about, the regulations right now are consolidated. They include regulations for family childcare and group and school age. Our reform area we're focusing on is to separate the 2. So there will be a set of regulatory standards for family childcare programs and a set of regulatory standards for group and school-aged programs. And the reason that we're choosing to do this is so that we can customize and really tailor the regulatory standards to the physical setting, to the ways that these programs engage with families and children in sort of nuanced ways. We want to be able to really scaffold those practices and promote health and safety in an effective way that is conducive to care that happens in those particular settings. One example that we're talking about here, we have programs that operate in shared spaces, a community space, a YMCA. We want to make sure that there are no barriers for those programs to be able to both comply with our regulations and offer quality care. So really making sure that we're tailoring regulations for the setting. We want to ensure that regulations are observable, measurable, and verifiable. And this is about mitigating the effects of a subjective system. We want to make sure that when licensors go into programs, they have a shared understanding with providers, with licensees about what they're looking for, and providers and licensees and educators understand what is expected of them in terms of the regulatory standards. And we want to be able to measure those in a reliable way, and that's how we're going to get to the KPIs that Andrew talked about, and that's how we're going to ensure that there's a trusting relationship and a partnership with providers and EEC. We also are committing to consider new and alternative program models. When we're talking about removing barriers, we want to make sure that a program can engage with and comply with these standards without needing to compromise their own individual philosophies. So programs that are, let's say, an outdoor nature-based program, a Montessori program, our Head Start programs, a community school program, making sure that we've established robust standards, but not standards that are going to be prohibitive to these programs to be able to move forward in supporting families and children that they serve. We are going to clarify the teacher qualification requirements and align with the new educator credentialing and supports, which you're going to hear about in a little bit, making sure that the licensee and the staff at the program are clear on what the expectations are for at higher professional development, and that there's an articulated trajectory for professional development and expectations set for staff who are working with children. And we definitely want to promote CQI, quality and ongoing improvement. And the way that we envision that is that it's starting right at licensure, that you're engaging with your licensor in a CQI plan, you're having a conversation about identified areas of strength, identified areas for improvement, and you're working on those right away at the start so they become kind of second nature. They're not something separate from what goes on in licensing. And then really making sure that we've simplified the standards in language,
in the ask, making sure that we have nothing gratuitous. We have just the absolute minimum of what we need to have to articulate clear standards for health and safety and interactions and curriculum and those kinds of things. And of course, making sure that they're easy to use for both programs and for our licensing staff. So really, we have multiple audiences who will use these regulations, and we're committed to making sure that we're responsive to the needs of all users of these regulations.
So how do we do this simple task? It's going to need a lot of stakeholder engagement. So on October 20th, we are re-engaging the conversation, and we are moving forward. It will be a day-long conference with our licensors, supervisors, investigators, regional directors, quality staff, and others coming together for the entire day and working in working groups to talk about issues regarding childcare. What are the barriers to having them do their job? What are the barriers that they see for providers? And what are the strengths? What's working well? And then where do they want to see, what would they like to see in the future? That's just the start. We then will build out into working groups. Our working groups will be internal and external. We know that we can't do this alone and that we don't know everything. And so we need our external partners to also come in, educate us, and talk with us. Again, that partnership is so important to support quality childcare. And so we will then build out our working groups, and then we will do more engagement with our partners, with families, with providers, with educators, and then ultimately come before the board and ask that we be able to put out for public comment and go out to public comment. It will take a while. This is not going to be an overnight, and we're going to work hard on this, and we're going to ensure that what we come out is a good product, not a fast product. So please be patient as we move forward on this.
Questions, comments?
I have like a meta comment that may or may not actually be right in the bullseye of this exercise, but this exercise is making me want to ask collectively that one of our goals is affordability. And we are among the most expensive childcare in the country. And I understand one of the drivers of that is staffing ratios. I don't know how big of a driver it is. I think there's probably 4 other drivers I'm not clear on. And so this conversation is making me wonder, as well as the upcoming credentialing conversation, I didn't see a goal explicitly about explore how this exercise might help us with affordability. And I don't know if that's the right goal, but I wanted to at least put it in the space, because if we do this every 10 years, let's not miss an opportunity to think really outside of the box, despite the fact we pride ourselves, of course, on having that best, regulations, and all the things we pride ourselves on also are the things that drive our costs up.
So I see affordability within accessibility, and this reg reform is really about making childcare accessible to families. And so within that, we do need to be considering, okay, if we want this regulation, is there going to be a cost to it? Is that going to drive up the price, the cost? So you're right, I don't think it explicitly states it, but one of the overarching values and themes that we have today is about increasing accessibility. And that means cost cannot be prohibitive to families to have their children attend.
And I appreciate that. Let's not drive up the cost. And I'm wondering,
if we can reduce it as well.
Is there anything
Yes.
out of the box, at least to give ourselves permission to explore in this process, to find ways to drive costs down without compromising the things that matter?
And I think in the planning sessions, one of the things we've talked about is there is no dumb idea. We want all the ideas, everybody's thoughts, whether it be internally or externally, and we need to be thinking about that. So when you talk about ratios, that's a question.
Okay.
Do we have the right ratio? Should we change those ratios? Immunizations, I wrote it down about that, and I'm thinking, well, in schools, they have time. Why aren't we? It immediately came to my mind. So all of that is there. And the only thing that I think is a must is we need to think about health and safety. Short of that, everything needs to be open and talked about and thought about, and making sure, again, that these are not for today, but they're going to work tomorrow. that they make things accessible, childcare accessible, and that they're understandable for everybody, because we hold people to standards. And when I hear, well, they weren't really sure, they thought they were following it, but they weren't because of, well, how do I hold somebody accountable to that then? Because my accountability is I'm required to make sure that it's understandable, and that and then the licensors will help if there is questions, but it still needs to be understandable and not subject to a lot of interpretation.
I think part of the answer too is really not thinking about the licensing in just in its own context. But I should have mentioned earlier, like the cost of care study that we did. A fundamental first costing out was our licensing standards. So definitely the cost of understanding what it is for a program to have to deliver the licensing standards as they are. And as we continue that work and look at options in our licensing, we have a whole model that has been built around this cost of study, where we can actually enter in changes in ratio, changes in staffing patterns, and understand what the impact on cost would be, which would be both for parents but also for the state as a payer for many families. So I think as we proceed with the work, as Andrew said, we'll have to understand if we want to change it over here, what happens to the cost over here, and what does that mean for the businesses. So I think we're really looking forward to the stakeholder engagement so that we can really hear from our providers which are the things in the regulations you think make the most difference in terms of the quality of care that you're providing, and how can we make sure that we're keeping what's in there that does that without creating overly burden for not just the providers but the families as well.
Other questions, comments from anyone? Okay. I would, if I can just add real quick, it struck me, and I think, Joy, you mentioned it kind of at the end, where we started and where we ended. 52% of the team at EEC is part of the licensing department, do an unbelievable job. Part of this, I hope during this process we call out the needed support that department's going to need with these changes too, as we think about the mindset change and the regulation change. Because I wouldn't call it an area of reform, because the team does an amazing job today, but how do we make sure that we're actually calling that out as a thread of important work embedded in this, so that they can be not only the folks in the front line that are focused on health and safety, but that technical assistance and that front face of the department. And so just making sure that we call that out. And second, I think about, and the team here has done an amazing job, but how does this is a big deal. And how does it continue to layer into all the other work, right? So that the work is not done in isolation. So when we're talking about encouraging people to enter into the field or start an FCC, what does that whole journey look like? Not just the licensing journey, but the credentialing journey and the FCC system journey, and how do we really start to think about it holistically so that our providers benefit from it, but ultimately I believe our children and families will benefit from it as well if we're thinking about it that
Absolutely.
way. So,
Absolutely.
Joy, Michelle, Andrew, Maria, Lorelei, thank you for joining us today.
Thank you.
Thank you. Thank you, team. Quick break?
Yeah, we're going to take a quick 10-minute break and we'll reconvene. Next agenda item.
Great. Thank you so much, Mr. Chairman, and I'm welcoming Jocelyn Bound and Ellen Grandine. So as you heard in the last presentation, educator requirements, certifications are actually in regulation right now in quite a level of detail. And part of our intention through the regulatory reform process is to simplify those, make them more understandable, and also take out the parts that don't belong in regulation and really should be part of our professional development pathway and credentialing system. So we are setting standards and expectations about hiring and staffing, but that we are making sure that
you are unmuted.
Thank you. That the support, the professional development, the ongoing requirements for staff to continue down a path and to grow professionally and advance their careers are part of our credentialing system. So connected presentations to the licensing regulations and the work we want to do in our credentialing system is definitely predicated on making those revisions within the childcare licensing world. I also want to just say that I have talked to a lot of folks, including during my first tour of duty at EEC, who have served on working groups and task force and commissions around creating a meaningful career pathway and credentialing system for the early education workforce. And since COVID, when we suspended our certification system, which was creating a barrier in some ways for hiring, we promised we would get back to the table and try and really do credentialing work and make sure that we were creating a meaningful pathway and recognizing the experience of folks in the field. And as we think about compensation and recruiting new folks into the field, this work is as important as it has ever been. So I'm really excited that Ellen and Jocelyn will be able to share with you sort of where we are on the work to create an educator credentialing system, and similarly share sort of current state and our next steps for engagement with the field around where we're heading. So Jocelyn.
Thank you very much. It's great to be here to talk to you about this topic. I've been looking forward to having an opportunity to talk more about credentialing. I think it's something we've been spending a lot of time thinking about, but it's been very much in the development side of things for a while, and it's nice to have a chance to come back. You just heard a fair amount about, at a high level, about our regulations and how they're structured. Our current educator qualifications are situated in our program regulations right now. So the requirements are based in minimum hiring requirements, minimum requirements for serving in particular roles in a program staffing structure. And I think that what I want to call out is some of the pain points and challenges that creates for creating a credentialing system with a broader perspective around how are we defining our expectations for educators in the field, in a profession where you move from novice to expert over time, and we're really mapping out what the expectations are for that journey. So right now, we have licensing regulations that set different requirements. Sorry, I'm still learning how to use reading lists. And this is a very challenging dynamic where there's far and near that I need to focus on.
You're going to recommend progressives when you get there?
That just feels really challenging to me right now, but we'll see. So right now we have licensing regulations that set different requirements by program type. The structure of the requirements, how they're enforced, is really fairly different. So if you're an educator working in a center-based early education program, there's a set of certification expectations. We do validate, or have in the past validated, those qualifications are met and given certificates. If you're working in a family child care provider, there's a different set of expectations, and we license you as a family child care educator, even if you're really just wanting to work as an assistant in a family child care program, but all of that is done through program licensure. And there are also requirements of out-of-school time programs, but not with the level of verification that the other two systems have. Those also focus on the minimum requirements for each of these roles that I talked about. And all the details are written into the regulations. So there isn't a lot of flexibility that EC has to be responsive to needs that we're seeing on the ground at any particular moment in time. The family child care expectations are focused predominantly on experience. The center-based early education expectations for certification focus pretty heavily on a combination of experience and the extent to which an educator has taken credit-bearing college courses in particular subject matter that is relevant for working in the field, like child growth and development. But there really is very little flexibility in that degrees can be substituted for experience, but not for those particular credit-bearing course requirements. And I think one thing, the commissioner referenced the minimum hiring requirements, the flexibilities that we put in place during COVID. That was really EEC's response to a situation where we needed more flexibility than the regulations provided. So one thing that we would like to think about as well is building a set of regulations that really anchors the expectations in the staffing expectations of programs, but doesn't become the defining statute for all the details of what we will expect with educators. The other piece of that the regulations set up for programs is they set the staffing expectations. There are some references to that, but I think in some ways this is in part a response to one of your questions, is that you need to have particular roles and a certain number of educators with fulfilling the minimum requirements for particular roles to meet the ratio expectations. And the way it's structured currently in the regs has led to a situation that we've seen looking at the C3 data where programs really pretty heavily hire certified teachers. And to meet the staffing expectation is far more effective to have 2 certified teachers in your classroom than an assistant, for example, and a certified teacher. So, I mean, I think you can see that that affects the cost of running a classroom, and there's very little flexibility. You cannot have somebody leave the classroom for a bathroom break, for lunch, during much of the day without having a replacement for that certified teacher in the classroom. So I do think there's some places that we can, sort of think about without holding to the health and safety that comes with the ratio requirements that we have, which are important to support adequate supervision of children. We can think about how the rigidity of the staffing expectations can also shape the costs for programs. So looking to the future state, what we'd like to build is one credential system for all program types. So instead of having these sort of disparate expectations for disparate program types, we have one set of expectations that maps what does it mean to be an educator when you first enter the profession and as you grow in your professional skills. And to create a set of expectations and verification processes that value educators' investments in degrees. So one outcome of the focus on the individual courses that educators are expected to take is we have many educators who take 1 or 2 courses, but they never continue on to a degree. Often they're taking those courses at different institutions because that's what's convenient at any particular time, and then it becomes really hard to articulate those credits across institutions to a degree. So create a system that really does value the degrees as an important pathway to both professional growth, but also just important for educators themselves in their own personal and professional growth, while also recognizing that there's a great deal that's learned on the job, and there are many ways that we can support educators in the professional learning while working, and also valuing that pathway to professional advancement as well, and creating a system that provides these types of flexible pathways for educators.
I think it's really embedded in what Jocelyn's saying, but if we're trying to recruit folks into the field, we want to support, maybe they want to start as a family child care provider because they have a child of their own and they want to start there. And maybe they then wanted to open up a center-based program or become a center-based teacher, that if we can create a credentialing system that allows a professional movement within the field, we create greater flexibility in both hiring for programs and professional development for the folks entering. They can see that as they're coming in. Like, I may start here, but if I want to go there, I can follow a single path instead of starting from scratch on a totally different path because I decided I wanted to go from family child care assistant to a center-based program.
And that's currently how it is.
That's how it is now.
Yeah.
So I'm wondering, what does value educator investment in degrees actually mean?
So instead of having a system where taking one child growth and development course is the sole focus of the expectation, and a degree of another type that is related but maybe not exactly the same can't substitute for that, have a system whereby you can say, okay, if you achieve this degree, here's where that puts you on our system. The degree itself has value in our system, not the individual courses.
So monetary value, prestige,
so
status in the organization?
I think I might move ahead because there's another slide where I can talk about the sort of
great.
so what of that. I think the last thing I'll say on this slide, and then I might just skip the next few slides because I think you can read them at your leisure, but they really just outline the details of our current requirements. In building, to the commissioner's point, what we want to create is a system where every educator receives credentialing at sort of the level that is appropriate to where they are in the field, and that's true if you're center-based, if you're a family child care, if you're in an out-of-school time program. And that would replace the certificates that some portion of our field get, but not everybody, so that you can start to see where people fit across the system as a whole, as opposed to just within an individual program type.
Jocelyn, I have a quick question. Qualified teacher or group leader, are those the same? Qualified teacher and a group leader are the same thing, or are they different?
So group leaders are an out-of-school time term, and a certified teacher is a center-based early ed.
That's actually a great example.
Yeah.
Like, why wouldn't we want to have there be more transferability? So yeah, as Jocelyn said, the next 3 slides are really more to illustrate how the current structure kind of sets these things in silos that aren't really about creating the meaningful career pathways we would want and the flexibility.
Yep. Yeah, so you can see the ways ratios are different and the expectations for how many children and educators you have across program types. These are the different roles. These are the roles for center-based early ed programs. your question, Jamila. These are the roles for an after-school, out-of-school time program. There are also ongoing professional development hours requirements as well, which are also different, both by how many hours you work a week, but also by the program type that you're working in.
Different and low.
And
Is
built
that-
into regulation.
And
Right.
built into regulation rather than flexible.
Right.
Or, yeah.
Yeah, I would say, as just a reflection on sort of current state, the focus on defining minimum requirements for entry has led to a situation where there isn't a shared ongoing commitment to professional learning beyond this requirement.
So in fact, maybe your
but-
point is, it's fine if it's low. The whole point is actually this is not where to tackle the
I think
desire to support the growth and learning of educators by
Yes.
changing this number.
this isn't part of the picture. I mean, we have to look at it.
Regulation, I mean, I think what we want to support, and I think what staff in the field want and program directors is opportunities for professional growth and advancement that are meaningful for where someone wants to go in their career. And I don't think the current regulations support that in the same way that the field would probably want, right? We're hitting a target versus having somebody have sort of a separate pathway. And something Jocelyn said was just really important is to having it embedded in the program licensing versus having a separate system dedicated to the professionals working in the field, regardless of setting. And that's what the vision of the team is, I think.
And I mean, again, just taking this particular example, these ongoing hours should give you advancement as a professional. This is professional learning. This should be designed to be professional learning. It should focus on the skills that are most important in the moment for you as an educator and where you are. And after, committing your time, you should see it counting for something in your advancement. So I think, that is wherever we end up situating all these different pieces. And again, I think we have to do the look of thinking about, okay, what is connected into regs? Because there are some pieces that are important to hook into regs, but what is also in the policy of the credential itself.
But I think what we want, instead of the licensors going in and making sure that this site leader has done those 5 hours and it's in their file, that we're supporting that professional development has led to the next level in the credentialing system, and therefore hopefully greater compensation and other. Sorry.
Stephanie, go ahead.
Yeah, hi. So I just have a quick follow-up on this. Are we imagining that it could be possible for someone who was a school-age after-school provider to then move down into a center-based childcare program, or a center-based childcare program person being able to move up, and then also having those folks maybe start their own family childcare? Is that what you mean in terms of the flexibility? I know you said across settings, but are you also talking about across ages?
Yes, I think across ages is a little bit more complicated because there are actually, the aspects of your professional knowledge that are different depending on the age you teach. So that is one thing that we need to think through the specifics of what that looks like. But in principle, yes, that is the goal.
I think you have that on that.
Yeah, so this is the family childcare structure. This is the slide that I think might help a little bit. I will call out, this is draft. This is only for discussion purposes. I don't want anyone to think that in any way, shape, or form this is final. And Ellen will talk.
I'll repeat it for you. This is a draft.
Thank you.
Yeah.
For discussion purposes only.
Yeah.
Ellen will talk a little bit about some of the outreach that we have planned to start engaging in conversation around some of these ideas. But what we wanted to get at is an idea about both, sort of the ways we're thinking about different professional levels, and we'll come up eventually with better names than level 1, 2, and so on. But there's a foundational level that is really marking what we would want to see the entry-level educator do. And then you have levels of expertise for the educator, the person who's in the classroom and has some responsibility for managing a group of children independently. But recognizing that there's, your first year as a teacher is very different than your 10th or 15th year. And we can, mark that and recognize that, and not just sit at like, well, this is what you need just to be able to be successful in your first year, but we can actually mark out multiple levels of professional advancement. We are currently working on the foundational level to level 2 right now with a team from AIR. 3 and 4 are planned for the next stage of work in this approach. The other thing that I wanted to call out here is we wanted to show the ways in which both roles across different program types do have a home in this credential, and make very explicit that, for any educator who is currently qualified per the regulation qualifications to serve in a particular role, there will be a place in this credential that does not require reapplying for the certification and the qualifications that have already been gained and documented will be recognized in this credential. But the other thing to recognize, too, is that we don't necessarily need to tie the levels specifically and tightly to particular roles. So you see FCC educators are reflected here in different places. You can be an FCC educator that's just starting, you're relatively early, or you can be a very experienced FCC educator. And those educators might fall in different places on the credential, given the professional experience and knowledge that they've gained. The other thing that's very much under development, so you see directors, for example, and other types of administrative roles in different places, is figuring out exactly how we recognize the complexity of that job. It's actually like 3 or 4 jobs. If you start to break it down, they probably all fit in different places in this structure. So some pieces to sort out. And also thinking about how we recognize the expertise that we would eventually want to see educators to have in the age group they're teaching. It's very different to teach a group of infants than it is to work with a group of elementary school kids. So there are differences that need to be recognized. And then finally, what this does provide us is the opportunity to start mapping out a diversity of roles for the more experienced educator. Right now, the pathway is really teacher, lead teacher, director in a center-based early ed program. But when you think about the support system that we've been talking about in other conversations that we want to build and the range of opportunities that there are for those with strong professional expertise to support others in learning the skill, their coach jobs, their curriculum specialist jobs, it's not on here, but FCC home visitors coming out of the FCC systems, educational leaders who are really focusing on the support of educators in the program. There's a diversity of roles that educators can move towards in their profession that we can also recognize through the development of this credential. Ultimately, I do think it also helps us with the salary question. I can't map a direct path from developing this to promising educators salaries because we don't obviously pay educators directly. But what it does is it maps out a different range of expectations, and it is something that we could hang a draft salary scale on, and something that we are thinking about doing is, building on the work, the cost work that was done by Selfie, where they sort of started the thinking about what would salary expectations look like, and create a more nuanced set of draft expectations that could be tied to different levels in the credential.
And that programs could uniformly adopt and use.
Yeah, and I've heard...
And connected to the credential that the state early education and a school-time agency are issuing, right? Just reinforcing this is a conceptual. But I think we wanted to present it as the idea of sort of this integrated and greater flexibility in the pathway.
Yeah. And I have it would be helpful to have a draft scale. Sorry, Stephanie.
Go ahead, Stephanie.
Yeah, just a clarification question. I heard what you said about, the director job might be 3 jobs in one. I agree with that. But can you just provide me a brief, concrete example about the difference in the credential of a director at, say, level 2 or a director at the 3 and 4?
I can tell you, yes, draft. Like, this is my thinking. We haven't done the work to start to really map that out. But from my perspective, somebody who's at 3 or 4 is really serving in a very meaningful way as an educational leader. They're bringing their expertise as an educator to support the educators in their program and learning and growing on the jobs in a range of ways, versus focusing more tightly just on the administrative tasks.
Yeah. Stephanie, sorry, do you have a follow-up? I was about to jump in.
No.
Okay.
No.
This is so fabulous. I'm really motivated, excited that we're doing this. And I'm going to just put in the space the question for the to incorporate into the process of how you might think about quality as it relates to educators. I know that is not an easy topic and complex to know, but is that on your radar as a dimension that you're going to be thinking about with the
Yeah, I mean, I
levels?
would say this is the starting place for quality, because it is this professional skills that the field brings to the work with children that is what is going to create the quality interactions, the quality learning opportunities that we want to see for children. And then the piece that I think comes next to layer on top of this is what are the structures that you'd want to see in the program that support educators in both building the skills as they work and bringing their best selves to work. I mean, I think we also know that, a very, very skilled educator can perform poorly in a context that undermines their skill set. So ensuring that programs are really supporting educators in using their skills, using them effectively, and also learning and growing.
And the other thing I would add, and it goes to the question just prior also, is that they're in development, but competencies that at each level. And so there's a deeper, more comprehensive level with each level as educators progress.
There will be some method for determining
Verification
competencies.
and observation and.
Okay, to advance into
Yes.
by level.
Yes, yeah.
Thank you,
Great.
Ellen.
Yeah.
Yeah, each of these levels, we're starting to map this now, will have a set of competencies and expectations tied to it, as well as a set of verification expectations that are
And then we
mapped
would
to the
have to
competencies.
implement an observational system that doesn't currently exist or.
Observation, verification.
Yeah, I mean, that is
Okay.
In the works.
that is the art of developing this,
Yes.
is
Okay.
figuring out how to do that in a way that is effective and gets at what we want, but also feasible.
And we can talk about what we're working on in that next slide.
Good segue.
Because it's not going to be done well, it won't just be us doing that.
That's right.
Right? There's a system of professional development that is more disparate than we would like right now, but can be really part of this if we can anchor it in a set of common expectations more than we have now, right?
And this next slide provides an overview and timeline of the work that we're currently engaged in with the American Institute of Research, which is we refer to as AIR. And included in this work, and it answers some of the questions that have come up today, are draft competencies in alignment with the National Association of Education for Young Children standards.
Can I
And
say something?
sure, go
Sorry.
right ahead.
Also thinking back to your question, one thing that we've done is taken those and started to group them in the same quality categories that we've been using for the quality system. So also thinking about how we're organizing everybody's thinking around the same set of competencies.
And we're starting to put those together for review and comment. And then we're also working with the AIR on research into other states and credentialing models that have been conducted and best practices that have been identified. And we'll be meeting with some of those states in the next couple of weeks. And then we've also disseminated a two-part survey to identify gaps in professional development and specifically to engage our partners in higher education. And we're halfway through, actually. All of the colleges have responded, and we'll be looking at their student learning outcomes and alignment with the competencies and the work that we're doing in the credentialing system. And then, as you saw today, there are drafts of the first 3 levels of credentialing, as outlined in the prior slide, with additional levels under development. And then our next steps in November, we're going to be conducting stakeholder engagement activities that will be facilitated, and that's where we'll start to share the competencies, credentialing structures, and we'll begin to gather feedback both internally at EEC and then externally in the community. And then by December, and this is at the end of our contract with AIR, we'll have a draft for a verification process, which gets at how we'll develop the next steps for how the credentialing, the competencies are verified and documented.
Great.
Can I ask one more question?
course.
Sorry, this is so fabulous. Does this process integrate with the licensing revisions?
Yes.
Yes.
Because we
okay,
have to
that's-
revise the regulations
Great,
to
got it.
enact
Okay, that makes sense.
the system. Yeah. that regulation review is an enabler of this. We can't do
Right,
this.
right.
until
If
we
not,
change
I
it.
see. Uh-huh.
Until we change that. Yeah, so.
But in changing that, we'll be as they're going through that, you're previewing how it will eventually link so that
And
they'll
inform policy.
design that. Okay, that's smart. Good.
Because you guys are so smart.
Sorry. Fabulous.
Any other questions or comments from the board? I just want to say thank you on behalf of the board, and we've heard this in the field, how important this is, and it's so exciting to see it kind of moving, so I appreciate, I know you guys feel like, I think you guys said you're in the weeds of it right now and in development, but appreciate the update, just as we think about how all this work intersects, and so I appreciate that, thank you.
Thank you.
Can I say
Yeah, of course, Maria.
I
Yeah.
don't want to miss the opportunity. I know this is too early, but just make sure we find a link to the C and the certification of teachers in order for them. I know you're thinking about this already, but
Just
the
send that email.
school age,
Yes,
you know,
we need to
opportunity
Yeah.
for teachers.
Yeah, and they're an important stakeholder, so.
They certainly are. Thank you.
You mentioned higher ed, I can make an introduction if you need one to, but thank you guys.
Maria, I really appreciate those comments too, because I know we're, educators are going back and forth between our early education and out-of-school time settings and the public schools, and being intentional about that in terms of thinking about it is also an opportunity this provides.
Thank you.
Especially for those of you who run both.
Yeah, yes.
Well, that's a recognizing that I've come to the after-school time programs are a great recruitment tool to the broader field. Yes, get them while they're young.
Absolutely.
Great, thank you, Jocelyn.
Okay, I
Thanks,
think you're
Ellen.
staying,
I'm
right?
staying, yes.
Okay, and I
Sure,
wanted
there's another
to
break.
invite Jose Mendez to come up as well.
That is not.
Yeah, so, and while he's coming up, we have each year come, since I've been here, with a sort of emergency or one-year proposal around the regulations governing our capital improvement program, or our early education and out-of-school time capital improvement program, commonly called EOST, which we administer with our colleagues at CDAC and the Children's Investment Fund, and Teresa Jordan's here as our partner in this work. And I remember Carolyn Kane said to us last year, as we came with our this is what we want to do this year, and asked you to vote on it. She said, can you just bring us a permanent proposal for how you want to move this program forward in the future? And that's what we are coming to do today. So we spent a lot of time and new staff working on the program and collaboration with our partners at CDAC and Children's Investment Fund to bring a proposal for how we would see this program going forward. I want to mention just a couple of quick things, and I think you all will hit on it too, but we are incredibly fortunate that the governor has authorized additional funding in this program through the capital budget. So we went from 6 to 10 million, enabling the proposal that we're going to be talking about here. I also want to recognize that the final FY24 budget included an additional 15 million for capital improvements, which is outside of the EOST structure and regulatory requirements. And we will be, they'll talk a little bit about what we're thinking in terms of those funds. But as you are likely recall, this program is limited to center-based programs that are nonprofit and serve 50% or more children who are subsidized through the Childcare financial assistance systems. And that 15 million has greater flexibility in its requirements, so will allow us to do some capital programs for family childcare programs, really thinking about some of our for-profit programs that serve a great deal of subsidized kids, which we do have in the Commonwealth. So what we'll be proposing today is really around the EOS structure, but we'll talk a little bit about sort of our plans and thoughts about those additional programs. And physical spaces are really important in terms of they can be inhibitors or facilitators of learning for our kids and also for our educators. So it's really an important part of sort of, I think, potentially recruitment of staff to work in beautiful spaces that are designed around kids and around them and learning. So one of the best parts of my job is going out and seeing some of these beautiful new facilities that are created by these programs. So happy to turn it over to the team. And as we have done in in the months past, especially for our newest board members. We're going to take a walk back and just make sure you're all aware of the basics of what this program does. And then a proposal about sort of how we're planning to go forward, teeing that up. Not going to ask you to vote on any changes to regulation today, but that vote would come at the next meeting once you've had a chance to marinate in the proposal. So Jocelyn, Neil, and Jose. Thank you. So I think we'll go through the thinking on the ES program first, and then we can also talk about the other 15 million as well. And Commissioner, I think you've really set this up pretty well. This funding does come from a housing bond bill, and EAC has been working with our partners to put this in place since 2013. So we've been at work on this for a fair number of years now. It was set up to provide support for large-scale capital projects. That's funding that's difficult to come by for other sources. Most philanthropic funding does not allow you to invest in capital expenses, and I think, as the commissioner said, there are many things in a program that is really important for the learning of children that incur a capital expense. The photo here shows a playground. That's, I think, a pretty dominant example of one of those significant expenses that programs incur. Outdoor learning is
classroom behind it.
Thank you. Outdoor learning is very important for children, and having the environment to do it safely is also important. But there are many things that programs have been able to do with this money over the year. Most recently, HVAC upgrades have been a really important part, which is critical for the safety of children. Expanding space, building in new windows. There's many things that have really benefited children in the program, and in some cases allowed programs to increase their capacity as well. So in this year, we have $18.8 million allocated. The Healy Driscoll administration did increase the annual capital authorization by $4 million per year for the next 4 years. So I think we're in a very good space. Plus, we have the additional $15 million that the commissioner referenced. So I'm going to turn it over to you.
Sure. So over the past few fiscal years, the regulations were amended to allow for smaller grant sizes, specifically from $100,000 to $500,000. That amendment was spurred on, obviously, by the pandemic. A number of agencies had a number of needs that included, but were not limited to, HVAC, as was mentioned before, roof replacement, new windows, touch-free sinks, and indoor space reconfiguration. Over these past 3 years, we've started a number of smaller projects. In FY21, did $7.5 million for 36 programs. 22 was 17 programs, $3.9 million, and FY23 were 20 programs for $8.5 million. For this upcoming fiscal year, we're considering taking a hybrid approach, and part of why we're doing that is because of the feedback we've gotten from past grantees as well as a number of other stakeholders. So smaller grant amounts for this upcoming fiscal year will consist of $200,000 to $500,000 opportunities, and larger grants from $500,000 to $1 million grant opportunities. This approach does require that there is an amendment to the regulations, which I'll allow my colleague Neil to speak to.
Good afternoon, everyone. As Jose mentioned, regulatory action is required to give EEC the flexibility to administer both large and small grant awards on a permanent basis. In November, EEC will seek board approval of regulatory amendments that will accommodate the awarding of both small and large grant awards. These amendments will include three key areas here. The first, allowing the commissioner to shorten the length of the grant term in order to be less burdensome for those smaller grant amounts that may in fact be awarded. Allowing the commissioner to adjust the grant recapture schedule to reflect shorter grant terms where applicable. The citation listed there, 606 CMR 15.042D, that regulation specifically lays out a schedule for percentage of grant recapture that's based on a program's non-compliance date. However, that schedule that's in the regulation contemplates grant terms of 25 years or 15 years. So the idea would be to allow the commissioner to adjust those schedules to potentially accommodate a grant term, say, in the 5-year range for a smaller grant award. And lastly, based on a similar line of thinking as the above items, allowing the commissioner to waive the requirements for a recorded mortgage lien and land use restriction against the property on which the capital improvements are being made for the smaller grant awardees. There's a high-level timeline provided below on the PowerPoint. November 8th, we hope to come back to the board and present specific draft regulatory revisions for approval, and public comment will occur the day afterwards, November 9th, till December 5th. And we hope to have final regulatory language for board approval and final promulgation on the 13th of December.
So I want, so thank you, team. And, you know, for those of you who've been on the board for some time, you'll remember that this was large-scale grants. It was major renovations for programs, and that was the original intent, and that was hardwired into regulation. And during COVID, the agency made a very smart decision, I can say that because I wasn't here, to recognize what the needs in the field were. And these smaller grants that allowed for outdoor play spaces and fixing windows that didn't open. I mean, we had an incredible number of programs that had windows that didn't open, fixing up roofs and HVAC systems, and opened up the idea of outdoor play spaces and nature classrooms. And it has been an incredibly important and valuable thing for the field. But applying the same set of standards and requirements to these smaller grants that we had for the bigger grants, and going back to just doing large grants, especially when you know, we're having a workforce crisis. So I think our concern about just doing the bigger grants was building a lot of new big empty spaces without being able to have teachers. And so having this hybrid approach will allow us to continue to support more programs to be able to improve their spaces for kids and for teachers and educators. And then also, you know, get back into the business of supporting some of the bigger grants and renovations, building new facilities, rehabbing whole facilities, I think is a really good opportunity for us. And the additional funding, plus the learnings that we've had over the last several years around the smaller grants, I think position us well to make this recommendation, and also to think about how we use the additional $15 million. One priority we have that will definitely be called out in the smaller grants this year that I wanted to highlight was around school security and safety. Something we've heard from a lot of our programs. There has not been a funding source or support in the same way that we've had in K-12, although I'm sure the K-12 system needs more as well. But you know, we were at an opening of a new program in Beverly, and they had updated their safety and security system with cameras and swipe cards for parents, and I think it provided a very important set of confidence and reassurance to the families. And so one of the things we're able to do with the smaller grants is be able to prioritize the opportunity for programs to apply for those kind of safety and security upgrades. And I think that's going to be really important for our programs out in the field as well. So, questions from board members? This proposal?
So the public comment on this made me want to ask about the structure of cost. The providers have to incur the costs before, like it's a sort of seems like it might be a burden on the providers. You get the grant after you've incurred all of your costs, and I'm curious. And you could also, it sounds like we're going to go through a public comment period where we'll get this input, but I am curious about the process and whether there's a burden we need to take into account on the financial side.
So, do you
go ahead?
We're in the process of reviewing the process.
Okay, yeah.
And looking at, you know, how does all this play out? What are the requirements? What are the reasons for each of the requirements that are in place? What's, you know, sort of an expectation based on the regulations? What is an expectation based on good management, good fiscal management of money, and how do we address some of the comments that we've heard from the field about the need to facilitate the process and the burden.
The burden, yeah.
So we're really committed, like in all of our, whether it's childcare licensing or childcare financial assistance, you know, to take a look at what it's been like from the user's perspective. And so there'll be an opportunity both through the public comment process, but the regulations won't hold us back from kind of looking at what the current business process is and identifying whether there's opportunities to simplify, distinguish between the smaller size grants and the larger grants, and where the burdens come in. You know, some of our smaller programs, for example,
don't have access to a real estate attorney, which is something they may need as part of this process, and
Yeah.
can we provide that as part of the process? The Children's Investment Fund does a lot of technical assistance throughout the process of these grants, and so we have an opportunity, I think, to figure out together how to make sure that we're eliminating unnecessary burdens in the process. So we're getting quicker to new capacity in the field and making sure, that we're asking for what is required for this kind of investment in terms of public, sort of public stewardship, but also not overly burdening the programs. And so, yes, this program is not free of that kind of same process look that we're giving most of the things that are happening at the agency. So look forward to engaging with our partners. And, we have now a very good group of folks who've been through this process who can help us identify where the pain points were for them or what was particularly helpful and at what stage in the process.
Would you mind talking a little bit about the plan for family child care providers? I know that that's kind of a bigger process that's kind of ongoing, and there's a lot of other things at play there, but I just want to make sure that they're not sort of getting left out of the conversation of capital improvements. And, this is all really wonderful for the group and out-of-school time programs, but want to make sure that our family child care providers are also, being supported in their capital improvements as well.
We agree 100%. And what's fantastic is that the new funding, because the ES regulations and the capital authorization process has been, very restricted to a very specific set of eligibility criteria, family child care provider have been excluded from this. But the additional $15 million will allow us to specifically focus on family child care. So we're in development right now about how to do that. We haven't done that before. We did do some small capital grants, I think ARPA related, so we can learn from that process too. But we'd really like to, there's been a lot of work done by our team around sort of how do we support new family child care providers, start up existing providers to go from smaller to larger, aligned with our licensing process and the pre-licensing visits. So we'd like to use part of that 15 million to support, it could be home ownership, it could be new providers coming into the field, so economic mobility and capacity development for family child care. We, as an agency, probably don't have the internal capacity to directly do those grants, so that's the conversation we're having right now. What is the comparable intermediary to like a CDAC or a Children's Investment Fund that could really have the expertise in family child care that would support them through that process, and again, really supporting economic mobility for those small businesses in our communities. And we have there's a lot of really exciting things happening in terms of the Treasurer's Office, the Cape Cod just announced a new family child care startup, so it's really an important moment for family child care. There are a lot of organizations, including our family child care systems, that are really thinking about how to build additional capacity in communities. And so I think we want to figure out how not to disrupt any of those things, but how we could use these funds to kind of leverage, support, and catalyze kind of additionally. And if there's a unique thing we can do with our dollar, like supporting home ownership or new facility development in family child care, that's what we'd like to do, but it's still very much in development.
Great. Thank you.
You guys want to add to that?
You said it all.
I'm just wondering, how do the centers and family-based care find out about these grants? How is it communicated?
So there's general outreach being done, specifically with our partner, CIF, Children's Investment Fund. We try to use as many email server lists, and we're going to be increasing our outreach as well. I think that's something that before I came on hadn't really been a focus, but what we're planning on doing is utilizing some of our leverage points, specifically in C3 and some of the areas where we have software and tools to do the kind of outreach or mass outreach that maybe we couldn't have done before. So that's our plan generally going forward.
So we can reach out. I mean, we have, through our licensing and through C3, we have contact information for most programs. We also now have really active on social media, so that's another opportunity for us to do outreach and make sure folks are knowledgeable about the programs.
Great, thank you.
Any other questions, comments? Thank
We'll
you.
look forward to bringing it back for a vote in November. Thank you all.
Thank you.
Just want to also just amplify and extend our thanks to the Children's Investment Fund for your partnership in this program. So thank you for being here today. Before we adjourn, any questions or comments from the board or anything? I just want to acknowledge a comment that was made earlier. I think the secretary, I think we've all mentioned it, the commissioner, that change is a process, not an event. It just strikes me every meeting that we're at about the amount of change that's happening within the system in which supports the field and providers and children and families. And so, you know, the stakeholder engagement, I think I saw 7 times within this presentation. And so I know we're asking a lot of folks on the team, in the field, to step outside of their day-to-day role, to add their voice to these system changes, and just want to say thank you. There is a lot of things moving here, and it always feels good when it's aligned, whether it's the workings of the team, the folks in the field, advocates in the field, everyone seems to be willing to add their voice to this conversation. And I believe it's what will ultimately change the system as a whole. And so just stick with us. We're going to keep asking for your voice and look forward to kind of the work to come on, especially today, thinking about the licensing regulation changes that we'll embark on over the next year and a half here. So really important stuff. So thank you.
Thank you.
A motion to adjourn. I'll motion to adjourn. Can I have a second? All those in favor? Opposed? Motion adjourned. We'll see you in November. Thank you.
Thank you all.